Hi, it's me, Brooks. Thank you for joining me today on Heal This. You are in for a treat. Today we have Dr. Chris Motley, and he is a distinguished functional health practitioner whose expertise encompasses traditional Chinese philosophy, integrative medicine, chiropractic care, clinical kinesiology, and frequency medicine. For nearly 15 years, he has been dedicated to private practice in Nashville, Tennessee. His holistic approach to healthcare caters to patients of all ages and all over the world. His areas of specialization include Lyme's disease, Epstein-Barr virus, chronic fatigue, thyroid dysfunction, adrenal burnout, parasitic infections, MTHFR, genetic mutations, emotional fatigue, and metabolic dysfunctions. Central to Dr. Motley's practice is a philosophy that emphasizes the uniqueness of each individual, ensuring personalized and comprehensive care for all of his patients. I don't know about you, but I'm pretty lucky to have some time with Dr. Motley. He's a rock star, and so I'm really excited to have this conversation. Hi, welcome. Thank you for spending some time with me. How are you today?
I am doing very, very well, and I'm so thankful for the opportunity. I really appreciate it, and to have somebody that I get to see, like literally many days in the office. So I'm just
True.
thankful that we get to talk and we get to like do a one-on-one about
I
all
know.
things of energy and healing. And I love your podcast name. And I know we
Thank
talked about that
you.
before, but truly, I really do love
Thank
the
you.
name.
Thank you. That's very kind. Thank you. So tell me a little bit about how you got to where you are now in functional health. How did you get here?
Well, I first decided to go to chiropractic school because that it helped my brother and my dad. So my dad had a bad back, and
Hmm.
he was supposed to have surgery. He was a drill sergeant, really injured his back during the military. My brother had allergies where he always breathed through his mouth. So my
Ooh.
dad had a chiropractor friend, and my dad didn't have to have back surgery. And to me, that was really, really important when I saw that, because my dad always wore a back brace. He could hardly go out and play with us. And then he
Hmm.
started playing with us, and I was like, what happened? And that got my interest even at a young age.
Hmm.
And my brother didn't have to do his nasal inhalers or his shots because he had his neck
Interesting.
worked on. So when I say functionally, I'll fast forward. As I went through school, I knew I wanted to do something to help people after
Hmm.
really thinking about it through high school. So I went the route to go to chiropractic university, and I was really, really intrigued by Chinese medicine. And the reason I got into functional medicine was because in chiropractic school, you're taught how to see the neck and the back and to find areas that are injured and adjust them.
Hmm.
And one thing that really was important to me was that I always had to stay busy. As you know, you always say comments in a good way to me, like I'm always on the run. But the thing
You
is,
are.
whenever functional medicine came into play, is because it worked on me. So I had a car wreck before I went to chiropractic university, and so my neck would be out of alignment. And you know how you see your clients and your patients, and it was always giving me a headache.
Yeah.
And it would get adjusted, but my neck would fall back out of alignment. And it was frustrating. And I had a friend of mine who was doing kinesiology mixed with acupuncture and acupressure, and they used herbs. And he said that it was my gallbladder, because the gallbladder meridians in acupuncture are these lines of energy
Hmm.
that are connected to the gallbladder, and they run down the sides of the head, down the neck, through the shoulders, down the sides of the
Hmm.
body. So you can have a problem with the gallbladder, and it can cause problems all the way down this pathway. So when he told me that, he said, well, we're going to work on the gallbladder points, and you need to stop eating rich, creamy foods and things that can aggravate the gallbladder.
Hmm.
But you're going to have to start doing things to help clean up your gallbladder. And at the time, he used this product that was from Standard Process, and I started using some of the gallbladder remedies. And after that time, my neck never went out again, and I didn't stop having headaches.
It's amazing.
That's what got me into working with functional medicine. It was the functionality, like you're saying, that in my world, if somebody comes into me and says, "Hey, doc, I've got problems with my shoulders."
Mm-hmm.
Part of me would say, okay, there's deltoid muscles and there are the rotator cuff muscles, there's the upper trap. The functional side of me says, well, the action of the muscle is truly determined not only by the bones and vertebra and the nerves in your neck, but also by the organs that are basically associated with all those little lines of energy that are running through the shoulder, which is acupuncture. So I would say, oh, my first thought is gallbladder, lung problems,
Mm-hmm.
colon problems, or even thyroid problems. The functional aspect is then going into their blood work and then going into their hormonal work and looking at these levels and seeing the discrepancy and saying they have a problem with these organs. They have a problem with this physical manifestation, whether it be from an emotional standpoint, it is expressing itself in a chemical way and a physical way. And so when I started to tie all those together, Brooks, that's what gets me excited. I would look into it and say, this is literally how when you and I talk about that it's all connected. We hear that terminology, it's all connected. That's the functional aspect I like to analyze and to deliberate which one is the highest need. And I
Yes.
think it's amazing that a person's
Yes.
body, their attitude, their way of thinking can determine how they express manifest
It
their
manifests in their body.
injury, their trauma.
Yes.
And so I hope that's in a nutshell how I came back
No,
to
that's
it.
perfect. And that's exactly what I was hoping, that you would hit on all those points, because I can come into a room and not know anything about somebody. And when you say shoulders or neck, I right away go to chakra area, right? This
Mm-hmm.
energetically, this is your truth center. And we know shoulders carry responsibility. So, I will
Oh,
ask
yes.
energetically, are you not speaking your truth? Is there something you're holding back? And then the front of the body is something that we're willing to look at. The back of the body is something we're really not willing to look at. So just, using all of those different techniques and now understanding Qigong and how all of the organs hold different energy and emotions. And it's just completely fascinating for me. And so I love
Oh,
talking about it.
you love
And
how the aspect how it holds. What do you like about? I mean, I'm saying this like Qigong, like because I was introduced to I mean, how many years ago? But do you find that in your practice though, like the movements, like is that what you're associating to with the movement of the body, and that's how you incorporate it into your work?
um both, right? Lack of motion
Mm.
is a big deal. But also where they're just carrying it in their body, and even outside of organs, right? And our legs. A lot of people will hold things in the back of their legs and they don't even understand
Mm.
why it's there. And I'm like, well, do you want me to tell you what the back of your legs mean? A lot of times they're like, no, not really. It means it's the call to level up. It's the call to level up. Energetically, our
Oh,
bodies are saying, let's level up, right? The universe is giving us something to level up and we don't do it. So if it's in the right leg, we are letting go of something. It's the masculine side of the body. The left side of the body is the feminine side of the body. We're calling in energy, so we're blocking it, right? So it's like I just go right to all of that and just start intuitive body reading, trying to understand what happened before this happened, because everything happens on an energetic plane before it manifests into a physical form. So let's talk about that part, right? Like that's how I talk to people
yes.
about it. So yeah.
Um, I love to learn and to study how the different parts of the bodies are associated with different aspects of our psychology. I love that you said the shoulders was, can I hold up something? And
Mm-hmm.
one thing that I think you and I talked about before, but that I really enjoy is Ayurvedic medicine
Mm-hmm.
and German new medicine, in the sense that our bodies would take a trauma
Mm-hmm.
and can store them in the brain and the brain patterns. And that can then be associated with, like you said, a certain physical part of our body in the distal area, somewhere else on the body.
Mm-hmm.
And that our psychology would say, like, I can't hold something up. it's a beautiful thing that our body says, oh, our shoulder muscles are meant to hold weight and to hold things up. And it's like, but if you psychologically have something bearing you down, they've shown even some, through some studies that a person will naturally slump their shoulders
Mm-hmm.
because the weight's too much, because they psychologically think that way. And we see that, when a patient comes in, you're like, why are you slumping your shoulders? I feel down and something's just burdening my heart. And you're like, you feel for them, you're like, and I love it that way you're saying, you're like, you know what?
Yeah.
That's the physical manifestation of what your belief systems and your traumas express. And being able to help somebody like that too, Brooks, it's like a privilege.
It is an
And
honor
it's
to
really
be in
taught me a
people's
lot.
spaces.
It is. And I can't tell you how much it's like taught me over the years. Taught me so much.
Yeah. Well,
Yeah.
that's going to one of the things I wanted to ask you. How has
Mm-hmm.
holding space for other people's healing, how has that helped you on your healing journey?
Wow, that's a great question. Wow, that is a really good question. When you go through the healing motions with somebody and learning how you can keep their energy, hopefully patterns to their body, even though you always exchange energy patterns,
Hmm.
holding space
And then
for
they mirror
them
each
and
other.
helping me, I think it also helped me whenever I was going through Lyme disease, that, I could have said something to the effect like, young Motley would have said, hey, why are you getting anxiety and why are you freaking out about this? You just have to sit back and think about it and you can let it go. Post Lyme Motley would say, I totally understand why you have anxiety, why you felt suicidal, why you feel so sick you don't want to function. And when you go through those problems, or you are treating somebody that has Lyme disease or parasites or has really bad emotional trauma, I've learned how to have space in the sense, like, especially with anxiety, depression, physical pain. I know you have too. When you start
Hmm.
to experience the gravity and how severely a person feels inside, you can't dismiss them. Like, just like, because their family or their friends are coming to you saying, my family thinks I'm crazy. People think I'm crazy. And I'm like, no, when you understand the pain they go through, and they come to me and you because they'll tell me these symptoms and I'll go, okay, yes, yes. And I don't dismiss it because I held space for that. And I think that whenever I know that a person has anxiety, some people are like, would tell them, oh, just drink some water, breathe a lot, and you can go. And I'm like, no, if a person had an
Right.
infection and trauma and their genes were not formatted to handle it,
Right.
they don't produce the brain chemicals to keep their anxiety low.
Right.
And the more I experienced anxiety with Lyme, I would go, Brooks, I'd be like, I'm about to freak out. I do not know why I'm about to freak out, but I'm about to freak
Hmm.
out and have anxiety, and I don't know why. And there's what is going on. And when I started
Hmm.
studying about genes, you get all complicated, but it really was helpful. I held space for that part. And now when people go through it, I go, they have an anxiety. I go, oh, they have an MAO gene defect. They have a COMT gene defect, and they probably have this, this, and this. Now, nobody wants to hear that on the podcast. They're like, that's the
Right.
most
Right.
nerdy thing I have ever heard. Like,
It's
I
great.
don't want
I
to hear
love
that.
it.
I just want,
Yes.
they're like, oh, okay, well, that was good, and I'm going to move on. But I think that it made me learn more, and it helped my capacity of to increase my knowledge about something, but it
For
made me have
sure.
more of a good empathy for people. And I
Yes.
think it makes us better practitioners. And
Hmm.
completely. I know you know the same. It's like I went through
Yes.
that and I'm like, now I know how to treat it because it worked on me. That's how I,
Yes.
when people ask me, I'm like, the only reason I use the things I do is because it worked on me. So that's
Yes.
how that holding space created that for me. Yeah.
Very well said.
How about you?
Yes.
I want to ask you, like,
Yeah.
how did you feel like that whenever they come to
Oh,
you? I mean, like,
um,
how do you practice it?
oh my gosh. Well, I definitely have learned a ton of compassion. I've learned that our bodies are freaking amazing. And if we kind of take away some stuff that we've got going on, they can heal themselves a lot of the times. I think if we're in control of our thoughts and we're in control of our emotions are not in control of us. And then we start really asking the questions, right? Like, what is going on. I really feel a lot of times we can get some answers, but we're bombarded with so much outside, pollution, or, our phones, or just other things going on, or negative intrusive thoughts, right? That we don't really give ourselves enough credit that we really can do the work. And it takes time. I've learned that.
Mm-hmm.
We want something instantly,
Mm-hmm.
and it takes time, and especially in functional medicine and alternative medicines and all of that kind of stuff. It takes time. I don't want the pill to take away the symptoms. I want to get to the root of it. I want to understand where this is coming from. And so holding that compassion and space to really listen to people, because I think the details are in there
Mm-hmm.
if we really listen. And also, people are so hard on themselves about their bodies and what they look like and all of that stuff. I think we should be praising our bodies a lot more, just being grateful that they work every day, and then tuning in when they're not.
When we talk about like the uh, the fact that listening, and it becomes where when you're starting to listen more and you actually can take the information and learn how to upload it into the body. And I think that people who have become really good listeners, and how to, like you say, how to listen has been so important for me about how to view life.
Mm-hmm.
And I know that can sound a little esoteric to
Mm-hmm.
some individuals, but if a person comes to me with a condition or a problem, the way that I've learned how to listen, I hope, is not to freak out about something or to
Mm-hmm.
judge right off the first, that I'm like, okay, I already know what this is. Some of the things I don't like about some practitioners that I've known in the past is like, you'll start saying something like, oh, I already know what that is. And that's true. There's a lot of times when you go, I have an idea what that's about. But
Yes.
learning the gravity and the amount of pain that somebody gets in by like understanding how they what they use, their inflection, and learning how to listen and to listen to those small nuances is like
Mm-hmm.
taught me to be a better communicator. But in all instances, it also shows me that energetically it's allowed me to learn how to take the load on, and it helped me to know how much I could. Because did it ever happen to you, Brooks? Like I would listen to so many different problems, and I would try to take all the information and learn everything I could about it. And I think it was better in my younger days where I could just be like, yes, I can take this information and I can go with it.
Mm-hmm.
But I'm thankful that when I learned how to listen, I also learned what I did not want to listen to. Now, what that means, it's not like I'm not listening to the person. It's just that what energy is coming to me as a practitioner that's negative, and I cannot do something about that. And it made me learn in my own life about how I wanted to view life, like what people I didn't want around me, I'm being honest, or what kind of
Yeah,
things I
no.
wanted to have in the middle of my life. And when we talk about like the capacity of knowing, having patience and learning, I think it's a beautiful journey. And I really mean that. I think it's taught me to learn how to listen, what I want to listen to, what I really want in life. And unfortunately, it's taken me a long time because I'm like an old mule, Brooks. You have to
No,
hit
you're
me over the
not.
head. I have to be hit over the head to like learn something. And I'm like, man, come on, Motley, learn it. But
Yeah.
um, this is great. I mean, I love that, like when we talk about that, about how we can have capacity, because there comes a point when you get really filled to your capacity, but we have to learn how to, flush some of those things out. And I think that's a whole other journey too.
Yes. Yeah. So you said a couple things. One, I always say your vibe is your tribe. So just remember that
Oh,
everything is energy, right? Wherever you're vibrating, like you said before, whatever's vibrating the loudest, that's where I'm going to give my attention when a client comes in. I'm going to be like, okay,
mm,
let me tell you what I'm hearing a lot of fear here. I'm hearing a lot of shame. I'm hearing a lot of, anger. Let's address that first, because that's living in your cells. Your cells know this about you.
mm,
So, and then also, there's times where I'm just like, I don't want to partake of those lower frequencies, right? Or I've taken
that's
on
good.
I've taken on a lot for the week, and I got to go decompress and get this out of here because it's not mine. I don't want to hold it anymore. And that leads me to asking you this. I mean, I know you've had some experiences in your life that because you go, 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 and you say yes and you do. And so, what do you do to decompress and take care of yourself? Because you have to take care of you so you can take care of others. And that's a big deal.
That is a really good point. That is a really good point. I think that, realizing how much love a person can express to themselves, it is that groundwork and saying if I'm willing to
Hmm.
show myself this much love, I then know I can give somebody else that much, love,
Hmm.
and do it safely. I
Yes.
think we're in this realm where we have to give so much to everybody else and not take care of ourselves. I'm like, if we get to the point where we're taking care of other people so much that we forget to eat, like literally, that's not having a capacity for self-love. And I think that, look, you and I laugh because we both have done it, and everybody else out there has done
Mhm.
it. We've done it where we were on a
Yep.
day and we were working with clients and patients like, did I eat? And when you have to ask yourself that, you go, I don't think I'm really
Mhm.
showing myself that much love. And for all the people out there that are listening, remember, that's what me and Brooks are talking about. Like, please
Yes.
share love to yourself. Please.
Yes.
Yeah.
It all
Um,
starts with self-love, and I think we are taught a lot of times it's selfish to love yourself, but I'm just talking about, like, really be good to yourself, show up for yourself. I was joking with you the other day that we're gonna have to start wearing, Camelbacks, and because there's times I
ah,
go, there's times I go 90 minutes without taking a drink of water because I'm working on someone, and then I'm like, oh my gosh, why am I so
oh,
thirsty? Well, because I haven't had enough water today. So yeah, you got to show yourself
ah,
some love.
you
You got
do.
to eat, you got to drink, but you also have to talk to yourself nicely. And I think a lot of people don't do that. There's that emotional
Mm,
part where um, you know, we're losers. We can't do things right. We can't, and a lot of times that shows up in our body. And we've talked about that before, but um,
yeah. Yeah. That's
what
a
are your
good
thoughts on
point.
that?
That's a great point. I think that like when we have that negative self-image and about like I love what we talked about well, hey, that's why like okay, when you talk about having a camelback on and having like water, I'm just saying like that's why like if I'm drinking like organic, I say organic coffee because I'm like in the middle of the day, like I'll have my water and my supplements. And I'm like, I'm gonna give myself like a treat in the afternoon. So I try to practice self-love. Like, what's my love language? I'm like,
Yeah.
oh, great cup of afternoon coffee. And my friend brought me
Yes.
this. And um, the belief systems, and that's a great, perfect leeway into it, is that when we're dealing with the energy and the frequencies around us, the biggest output that we can have is the type of programs that we have actually started in our belief systems. And unfortunately, like many times in my life, I use myself as an example. I know that, for instance, that I was raised unintentionally in some ways to have like this outlook of depravity, like as in I should not look for the best of things because I didn't have enough in life and we were
Mhm.
really poor when I was younger and we didn't have enough money. And so, we know that it programs you to think that I'm going to live very practical and very, very softly, and I'm not going to like try to push hard at times. Now, I'm thankful I've been working through that in my life, and I'm thankful that the practice has grown in a way to over exceed what I ever expected. But I have seen that the energy output of that belief system really has been where my whole vision outlook for a long time was I have to make ends meet. I have to
Mm.
make sure this all works or I'm not going to make it. And
Mm.
if I don't make it, everybody else is going to be in trouble, where I become
Mhm.
the savior for everybody else. And that really took a very big beating on my body. And
Yes.
but I'm with you. I think the energetic output from my tissue started to go out and I would attract those situations and those type of events that just fortified
Yep.
that belief pattern. And
That's right.
then I know we talked about this too. then I started to realize that the people around me that I had attracted, at no fault of their own, were the people
No.
who had the same thoughts. Like, "Oh, I can only make ends meet," and that's only fair because the energy that I put out was that's what I'm comfortable
Mhm.
with.
Right.
So with healing and our type of work, I really wanted to, and I have worked on it for a long time, was to have a belief system of optimism, as in being open to listen, like we just talked about, and trying to look at life as though, I'm going to have to fight against everything. No, I can receive
Mhm.
what I know to be good for me. Like a lot of things are coming at me this whole time, and I understand. But
Mhm.
even in healthcare, all the type of patients I want to attract and are the ones that have optimism, the ones that literally go, I think I can heal.
Yes.
And I realized that the patients who probably weren't ready to heal was because I was in that state where I looked at like, I got to make ends meet and then nothing's going to work out for me. And then so I literally, I don't know about you, Brooks, but I remember, personal story. I love to work with people. And at times I get so packed that I can't see any new people for a long while. And I'm thankful for that
Mhm.
problem. But I remember to meet a budget, I had a business manager that said, I think that at the time they're like, well, we need to like raise our rates because I had four other people working with me. And I was like, man, I don't want to do that. I really don't want to raise rates, but I hadn't raised rates in like 5 years. And so my outlook was, okay, well, I got to make ends meet. So I'm living at the level where I just can make ends meet and to squeak by. And so I was like, well,
Right.
that's the belief system that's kicking in, but I didn't know it. And when I did decide, okay, I started to realize I was at that spot. Like, I'm not saying I want to charge
Mhm.
more to like get fancy and big. I'm wanting to charge more because I wanted to make sure I paid everybody accordingly and that I was making
Right.
everything move that needed to move. And I went, I'm going to have to physically just bite the bullet and just charge what I need to, change my pricing, and send an email out. So I literally
Mhm.
begrudgingly wrote up an email and sent it to all my patients. And then I had a patient come in, lovely person, not talking bad about the person. And
Right.
this patient was she was like, I'm going to tell you something right now. You're going to ruin yourself. You're going to ruin yourself
Oh,
by raising your prices. And Brooks, this was only, I mean, I only sometimes it's a big leap, but it was $15,
yep.
$15.
Right.
And so she
Yeah.
said, you're going to ruin yourself and ruin your practice because it was $15. Now, this is from the same person who bought a brand new car every year and had multiple rental companies or rental buildings and
Yep.
tell me about the vacation she took. And I was wondering, like,
Right.
why would, some people can't afford it. And I said, well, I found out that the people who were probably not doing as well as she did gladly stepped up, but it was my
Yes.
mindset. And when I changed that mindset,
Yes.
I found that the people who stuck with me were the people who were optimistic. And I was like, oh, that's how this
Yes.
works. Okay. So that's where I'm like you
Yeah.
saying that's how like belief
Yeah.
system and energy that you put off really, really comes to the surface. Yeah.
Yeah. You're manifesting it, right? You have to really tap into your worth
Yes.
and say, hey, I'm not doing it to, you know, hurt anyone. I'm doing it because it's worth it. I'm telling you, I'm worth this amount.
Yes.
And also, um, you know,
Oh yeah.
like I said earlier, the vibe is your tribe, right? You're saying, this is the vibration I'm sending out, and this is what, and it takes a little while to, sift through it, and then it will happen, right? But, I,
Oh
I
yeah.
totally
Yes.
understand that situation. um, okay, so you walk into a room and you are like
Mhm.
thinking, I kind of think I know what this is, like you said before. You do muscle
Mhm.
testing
Mhm. Yep.
and you say, well, this isn't a bacteria, this isn't a virus or a fungal infection or
Mhm.
parasite. So what do you go to next?
Yes, usually if if I go into the infection, the next route is I always tell myself I find what microbe could be the possible problem. Then I search for the organ that is the problem, because then that gives me the idea of how the organ will manifest its representation of a problem through not only the physical aspect or the physical representation, but their emotional. So it goes into which organ, and that
Mm-hmm.
too, the organ tells me many things, but the two things are I look at all the physical features of the body and how it correlates to organs, and I ask them about their emotions. And
Yes.
that will tell me how big of a trauma is linked to their
Mm.
bacterial infection. And so if people out there are listening, it's like, what are you talking about? I'm like, well, if a person comes in and they have a bacterial infection in their lungs, and I go, okay, so the lungs in the Chinese medicine world has much to do with the skin, all the skin of the body, and breathing. So I naturally will say, well, how's your breathing patterns? And I check if they have had eczema, if they've had rashes all over their body. And the facial diagnosis would be if they have redness right in the middle of their cheeks. That's a big lung
Mm-hmm.
issue. So you and I would look at that and go, I suspect they've got some lung imbalance. And one of the biggest kickers, I'm not kidding, would be like the thumbnails. The thumbnails and where they meet the thumb bed
Interesting.
right there at that cuticle area, they'll actually have inflammation. And I've seen thumbnails that become loose, like almost with fungus because of a lung problem. So
Oh.
my mind goes from like bacteria right into that. Then I like to fortify and ask them, how is your grieving? Because the lungs would have to do with grief,
I was gonna say
sadness,
grief. Yep.
your ability to
Mm-hmm.
cry. And you know this,
Mm-hmm.
Brooks. Like we talk about that with an individual, and we're like, okay, that bacteria led me to this emotional grief. And then you
Mm-hmm.
can go back, and you and I've done this. We look back and go, well, what is the fright in your life? What made you gasp for air? What made you take a big breath in?
Yes.
And
Yes. Mm-hmm.
the amount of stories you and I have heard about like
Yeah.
this is what truly happened makes me know that the lungs are injured, but that the body allows certain things to accumulate in the lungs. A, because they've gotten weak over the years, and B, there's a balancing act. So that's where I
Yes.
go. Then I will go and find the herbs to help clean. And this is not herbs just to say I'm going to kill all the infection. These are herbs. It helps me balance their system to help them handle their emotional traumas. That's how I look at it. So that's one
That's
angle how I
amazing.
do that. I always try to find like
Mm-hmm.
herbs. I'm not going to go, I'm going to give you this to kill this bacteria. I'm looking at it going, what herb could I do to strengthen the lung chi, to
Okay.
strengthen your lung capability?
It supports the lungs and the immune system, right? And also kind of
Mhm.
neutralizing the bacteria there.
Y- yes, yes.
Okay.
So now we're talking about like with the neutralizing, like, are you saying the herbs? Is that what I would use to help? Is that what you're
Yes.
saying, Brooks?
Yes. Yes.
Okay. Yeah. Um, with that, like you would always try to, this is how I try to look at any type of supplementation. I would look at the idea of, like you say, increase awareness. I know it sounds kind of odd to some people. You always try to find the herb or the tincture to increase the awareness of the organ, because we work in Chinese medicine with the idea that each organ has its own mind. It has the Shen or the
Mm-hmm.
Po, or they have different organs have different mindsets. So it is the way that an organ would actually communicate with the brain, but really with the higher mind. So we look at it as each little building is like, I'm trying to do my job over here, but I can also
Mm-hmm.
affect this other organ. And so whenever you look at a supplement, you can't just go, I'm going to just use this to kill off salmonella. You have to go,
Mm-hmm.
well, I'm going to help strengthen up the stomach. But the stomach in Chinese medicine is an organ that also supports other organs, such as the lungs. Stomach it'll actually feed qi and energy up into the lungs and the colon. So I have to think about it, well, would this herb help not only the stomach, but would it support the lungs and large intestine to help the person poop out all the things that I'm cleaning out of the stomach? Because if it
Yeah.
doesn't, it just gets backed up. And then we look at the emotions of it, and I do my best. I'm not saying the best at it, but I think the emotional garbage that's in our life, I always compare it like, let's say you have the stomach in the Chinese medicine world and in our Ayurvedic, we know that there'd be like somebody who's always completely worried. Somebody worries so much that they're actually telling their stomach to stop digesting food properly because I got to have enough worry to run from the problem or fight or flight. And so the stomach acid gets really out of whack. But
Hmm.
then you look at it and go, I want to have an herb that actually helps them calm their worry down. And I want them to be able to, the stomach to be aware of how much worry is in the body. And then feed the rest of the organs so that they're communicating. That's the whole idea of like with all these
Yes.
Chinese medicine formulas. And when you look at healthcare like that, I don't want to go down a rabbit hole, but I'm saying like when you look at how interconnected each organ with its own mind, how it wants to communicate with each other, but still have its autonomy in some way.
Yes.
And I'm so thankful that there's ways that I've learned, and I'm not the expert at it, I'll tell you that right now. I'm just saying there's ways that I've learned that allows me to actually understand, like through biofrequency medicine and learning how to actually intertwine the emotional aspect with the physical and the chemical with supplements. Yes.
Hmm.
I hope that answered the question.
That was wonderful. It's so intriguing, and there's so much there, and I appreciate you sharing all of that. Um, I
Oh,
was
thank you.
I was going to ask you. So I think that when we were created, that we were supposed to function on that mind, body, soul, um, you know, all together, all connected. And we've done
Mhm.
a lot of work separating that. Our thoughts and our emotions are over here, and here's our physical body, and then here's our spirituality or our spiritual energy, right over here. And I think that a lot of times that we forget that they're all connected and that everything is speaking to each other. And so
Yes.
I tend to rely a lot on my intuition. And I say that intuition is a knowing. It is that other sense that we have. And a lot of times we don't listen. And it is a translation of energy. And we have to be tuned in to the right frequencies to hear the intuition. And I wonder, when you are working, I know that there has to be some part of what you're doing that is intuitive work, where you are really listening to the body and the translation of energy that's coming from your patients. And how would you
Mm.
express that? What do you think about that?
I think that like yes, intuitive nature. Like when we talk about frequency medicine, maybe I can give you an example. And please don't think I'm rude with this. Let me just show you. Um, this makes a lot of sense. I like to talk about intuitive. So I have small instruments, and one of them they'll see here at the office. And I know people who are listening can't see it, but the people who are watching, it's a small device and it looks like a little disc, like almost like a mason jar top, but it's called a resonator. And when I talk about
Yes.
intuitive nature to understand a person, there are certain frequencies, and there's frequencies all the time running through the tissue of individuals. And they'll say that vibration of our cells creates small electromagnetic fields around the body because of the movement of electricity, electrons through our skin and through our tissue and through our fascia. And that's creating these fields of energy that are just emanating from our bodies. Now,
Yes.
I think that with The Office, my mentor, Dr. Dowdy, was a very, very smart man. He did engineering before he became into chiropractic and kinesiology and acupuncture. But all that to say that when energy is running through our veins and running through our skin and it's coming to the surface, we have a certain level of electrical voltage, like shocks that are running along our skin. And
Yes.
that is literally connecting to the bacteria on the skin, the fungus on the skin. It's connecting to the hairs on our
Yes.
skin, and those sensors in our skin, plus those little microorganisms, make us very sensitive to the vibration patterns of other people and other things. And one of the things that Dr.
Mhm.
Dowdy, he mentioned he studied, was the use of like a small device that could pick up on the change of the static in the skin. So let's say like you and
Mhm.
I walk into a place where there's a person who doesn't have the best vibration, they're not part of your tribe. That vibrational pattern probably disrupts or changes the voltage and the microorganisms on your skin and your sensation, and it goes into your body and travels to your brain. And you go, I don't know if I like
Mhm.
being around this person very well. And
Mhm.
the same thing happens when you and I work on somebody that has a vibration or tone that doesn't agree with them. You and I pick up
Yes.
on things in their body and it changes us. That's why intuitively you walk in and you can feel it on somebody. You go, man, that person's shoulder's hurting. And they hadn't told me one word or one thing. And then people end out there
Mhm.
listening going, yep, I could walk into a room and knows about somebody's been hurting. Why? Because your skin has become so sensitive and your body, like a lightning rod, you can pick up on the patterns of others. Intuitively, there are some
Mhm.
people who are very smart and very gifted to actually be able to amplify that signal, to bring it up to conscious
Mhm.
thought. Literally, you can take a thought or take a vibrational pattern and increase the intensity because of the nature of who you are. I am not necessarily like that. I'm like, I always say, I'm like a monkey on a computer. I had to do things over and over again until I learned how to do it. But I have learned by using this device where I can rub the plate and I can feel the static change in my hand, while I'm pressing on a point on the person. And that's what I'm saying. Now, intuitively, I've learned over the years where I can pretty much, without using the device, I can touch the area on the person and go, I know what that is and I know what it feels like. But the
Mhm.
intuition
Mhm.
comes from where you get used to knowing which vibration patterns are associated with which problem. Now that's the real true, like the true healers. You know what I mean? Like they're so cool. Like they can go out and they go, you know what that
Yes.
pattern feels like to me? It feels like viruses. It feels like
Yes.
bacteria. And those individuals can do that. And some people are so
Yes.
gifted that they can turn the signal around and flip it and clean it out of the person. You and I, well, I do. I have to use acupuncture needles and acupressure devices, and I have to use electrical current. But that's the beauty of intuitive nature. How
Mhm.
does that fit in every day? Because I can amplify a signal, increase it by my intention, but it drains you a lot as a practitioner too. And there are some people who are
Yes, it
just
does.
so again gifted who can take let that energy run right through them and don't even pick at them, but it can pick at me. So every day, yes, using frequency medicine, the vibration patterns off the body, I do it every day. That's all I do. And they say
Yes.
reading the energies off people, if you want to call it that, yes, it's reading energy patterns off people. And that's what you do too. And people may think it's unusual, but not to me. I mean, I think if everything has a frequency and vibration, a certain sound, but then there's some people
Yes.
who are meant to read the sound and the vibration off people. So that's how I look at it, though. That's
Yes.
how I feel like my
Yes.
intuitive nature kicks in. Yeah.
Yes. So in the intro, I said you're a rock star, and I meant it because that's what I'm talking about. That's the kind of stuff that I do. I do not, my lane is not bacterias, viruses, parasites, fungal infections. No, mine is emotional blocks, traumas, stuff that's stuck in your body, your thought processes. And so before I even come into the room, sometimes I
Mm,
receive those translations of the energy that I'm like, oh, I know exactly what this is. Here it is. And somebody will be like, that's magic. I'm like, no, it's not. I have trained my listening, intuitive knowing to translate that vibration and to hear or see or feel or smell that vibrational frequency that's coming in. And I have chosen to strengthen that muscle, right? I mean, it didn't, you talk about a monkey on a computer, like the first several times that's happening to me, I'm thinking, well, everybody has this, right? Like everybody's seeing this, everybody's feeling this. It's not just me, right? And then I realized, no, they're not seeing this. They're not hearing this. And then how do I turn it on
no.
and turn it off? And how do I activate it? And how do I amplify it? Like you said. So to me, that is the future of healthcare and medicine, is using the gifts that we were given to really listen intuitively, and to debunk all this stuff about it being woo woo and weird. We were made that way, so we should be strengthening those muscles.
I agree. I think that people have different routes in life and can, you say, flex their muscles and train their muscles. And, people say, well, how would you do that? And ask you, like, how would you do it? It's like, you just, again, it's like there are certain things that you've trained your body to do and trained yourself to listen to and to observe. And at the same time, it's just training the different sensors in our bodies to be different than somebody who's a baseball player who can hit a fast pitch baseball at 97 miles an hour. But you and
Yes.
you can go in and you can take a frequency and a vibration that has to do with trauma and guilt and shame, and then tag it to a certain body part, because it creates a
Mhm.
hologram in our brain, in our mind, about what that person feels.
Yes.
And we're doing that on the micro and the macro level. But I'm saying that somebody can go out and think it's not unusual for us to know when the rain's coming, because arthritis would tell us, like, I can feel the change in the patterns of the air and I can feel it in my joints. And they would say, like, why do they say that happens? Scientifically, they'll say that we picked up on the ion change within the hairs of our skin. And there's some people that the pressure changes are evident in their joints. To me, it's like, if our bodies are that smart that we can pick up on the differences and changes in the actual electrical status of our environment and can feel the electricity running through the clouds, and aren't we able to, as beings, to be able to pick up on all the differences and changes in the vibration patterns and all the electrical output from another person? The answer is yes. I mean, we definitely can, and that's what you have done, Rooks. When that's how hopefully I have done in my life, where I can pick those things up. But I
Yes, you
know it's
have.
like, to us, it's not
Yes.
anything really different. It's like our everyday life. We're like, oh yeah, yeah, they have that,
Right.
and people are like, how did you
Yeah.
know that?
Yeah.
And we're like, we do
Yeah.
it.
It just, yeah,
Oh
it's
yeah.
awesome. Yeah. Um,
Yes,
Thank you so
yes. I
much
mean,
for your time.
this was so
I
good. This is
appreciate
so
you.
fun. This was
It's
great.
really good.
I
Yes.
appreciate you, Brooks. I mean, this is
So
like next level.
please continue what you're doing, and please continue spreading your message,
Oh,
because I see you on there all the time, and keep doing it. And you're helping so many people, and I'm really grateful for your time. So, revive your tribe, and
thank
keep doing
you.
it. Yeah. Heal this, right?
Thank you so much. I really appreciate it. Heal this. We're gonna have it's a great podcast. I really appreciate it, Brooks. Thanks so
Thank
much
you.
for having me. I really do appreciate you.